Hello, today I'm going to be talking about claustrophobia. Claustrophobia is a debilitating condition, and I'm going to briefly outline it today and talk about how one might tackle it in the consulting room. My name is David Kraft, and I am a psychotherapist in Harley Street in London, and I have worked with a large number of people who have suffered from claustrophobia. Claustrophobia is a compound word. It comes from the Latin word claustrum, which denotes being locked up or a place which is shut up. And then there's the second part of the word, phobia, which comes from the Greek word phobos, which means fear. Some people that suffer from claustrophobia become panic-stricken. And this often involves feeling really anxious in enclosed spaces, but it can also cause problems being on the tube or on the train when there are lots of people and one can't get out. Some clients feel very anxious indeed where they're in a crowded place, and they'd rather climb flights and flights of stairs in order to avoid being amongst lots of people and not being able to move. So, as I say, this debilitating condition can cause lots of problems with living, and some people, when they come to see me, they are frightened of going on the underground or on the bus or trains. So it's difficult for them to get to see me at all. Some people avoid air travel because you're in a very small place. In fact, a recent study that I did on flying phobia found out that a lot of it was to do with a fear of being shut up. It was to do with claustrophobia rather than other mechanisms involved in flying phobia. So this can be treated by psychodynamic psychotherapy, but it's important that you use hypnosis as well, and the technique that I use is systematic desensitization. This technique is very powerful for treating all phobias, particularly claustrophobia. In this process, you gradually introduce the patient or client to potentially anxiety-provoking situations, starting with the simplest and going to more difficult. So some of them suffering from claustrophobia might imagine being next to one or two people on a train or in the comfort of their own home, gradually working towards being able to sit on a more crowded train and then being able to cope with being in crowds. Once they are able to do this, that's the end of the treatment really. I also teach self-hypnosis, so you can master these skills when you're on your own. And this will involve using anchoring strategies and coping strategies, also breathing strategies and progressive muscle relaxation, amongst other techniques. Being able to do it on your own, practicing on your own, is called in vivo desensitization, and you combine the in vitro work, i.e. the work in hypnosis, with in vivo desensitization. You can affect change in a shorter space of time. The psychotherapy enables clients to gain insights into the root cause of this problem, and this also has an effect of relieving anxiety. Sometimes the fear of being shut up is as a result of being in enclosed spaces or being under a lot of stress under a long period of time, either in childhood or in adulthood. However, sometimes the being shut up and the fear of being shut up, it works on a deeper level and comes from childhood, either because of abuse or prolonged stresses of being shut up in the past. Hypnosis, together with psychodynamically oriented psychotherapy, is a very powerful double or treatment modality, multi-modality treatment for claustrophobia, and I highly recommend it. My name is David Kraft. If you are a GP or a specialist doctor, please refer clients to me. My numbers are below. You can use both numbers, the one in Harley Street and in Enfield, or email me. Any information you can find on my website, or subscribe. And if you are a client, also you can ring those 2 numbers below or email me. I look forward to hearing from you. Okay, many thanks. Bye-bye.